This is the Innovative Technology Project for Nursing N711, Nursing Informatics, Fall 2015, the Loyola University New Orleans School of Nursing by Jason Marsh. The problem I identified for my project is that patients in the hospital setting with severe mental illness and/or dementia are prone to falls due to altered perceptions of reality. The target population for the project are hospital patients with altered mental status due to mental illness and/or dementia. These are patients which we would normally use a safety sitter with. Current practices that are used to ensure the safety of the target population include safety sitters in the room with the patient. Competition would include companies such as Avasure, which offer similar remote video monitoring systems, such as the one that I'm going to propose. The proposed product is a pole-mounted video camera with low light capability to monitor patient behavior remotely. If a patient is observed trying to get out of bed, the attending nurse is called by a remote monitoring personnel on a cordless phone that the nurse carries. The system would operate over existing Wi-Fi networks within the hospital. This intervention would fall under the category of telehealth. Telehealth is a broad term used to describe many variations of healthcare services that incorporate telecommunications, including video monitoring. According to the Avasure website, the AvaSys system allows a single trained observer to monitor multiple patients simultaneously using a pan, tilt, and zoom camera that follows for full zoom viewing or up-close observation. The cost and benefits of the proposed technology. The initial cost of the system would include purchasing the equipment and having the IT department set it up. The equipment is very flexible as it can be moved from unit to unit easily. By having one safety attendant monitoring several patients, labor costs can be reduced. Additional savings will be realized as the number of falls decrease. Research at Barnes-Jewish College Healthcare found that a fall resulting in a serious injury cost an additional $13,000 and increased the length of stay by 6.27 days. Additionally, in October 2008, the Centers for Medicare and Medicaid Services stopped reimbursement for injuries related to falls, prompting healthcare facilities to review fall prevention programs and seek resources to reduce falls. The benefits would be one staff member being able to monitor multiple patients and over time seeing a decrease in falls and the associated expenses. The implementation, the rollout training would be scheduled to introduce the resource to unit nurses. This training would educate the nurses about when to use the service and how to request it for their patients. Additionally, a web-based training could be used to reinforce the material. That web-based training could also explain the policies and procedures for using it. The policies and procedures. A nurse would have to request the use of the remote video monitoring for a patient on a written form, which would be signed by the nurse's supervisor. The form would then be sent to the remote monitoring department, and the staff would bring the rolling pole to the patient's room and provide setup. Each shift would have to reassess the necessity of the remote monitoring and reorder the service as necessary. The efficacy of this technology would be measured by a reduction in the number of falls within the facility. Research suggests that only 20% of falls can be prevented. However, based on the cost of post-fall care and potential loss of reimbursement, cost-saving measures such as remote monitoring will be important because every dollar is going to count. marketability. The product is fairly simple from a hardware standpoint. A camera mounted to a stainless steel pole with wheels, maybe a stripped down IV pole could be used, and a Wi-Fi transmitter. The key marketing features would be a reduction of the cost associated with falls and increased patient safety. It could be pretty easily sold. The ease of use, increased patient safety, and decrease in fall associated calls would all be key points to use when selling it. I want to thank you for listening to my presentation, and I hope maybe you learned something that you can use in your units. Thanks.